Hey. You okay in there?
Awesome.
I like to say it goes away, but I had morning sickness for 6 months with my second daughter. Hell, who am I kidding? It still worries me sick.
Thanks.
It was worth it. You tell anybody yet?
Oh, no. Not until I pass 12 weeks. Not this time.
Nothing but good vibes.
It's nice to see that what's going on here is that she's pregnant, right? You know, initially when the camera comes to her, she's vomiting in the toilet, right? My mind went to the worst. I'm like, oh my gosh, is she sick? Who is she? What's going on? But she's pregnant, so she still has some morning sickness. That's what's implied. And it was nice to see that her colleague and coworker kind of checked on her. Not only that, seemed to kind of give her some encouragement. But I don't know if you guys caught on that the doctor who is pregnant, she specifically says she's waiting until after 12 weeks to tell people and hasn't told people. Now, there's probably many reasons for that, and we'll probably learn more throughout the season. But you know, we know that miscarriages often, if they're going to occur, often occur in the first trimester, and many people will choose to wait to tell others that they're pregnant until after 12 weeks, 13 weeks, things like that. So wondering if that's what she's safeguarding against. Also, there may be an implication that she's had pregnancy complications in the past, which of course would be very devastating, and so many families experience this.
Morning, Jack. What are you doing here? I'm working. And you?
Well, I don't know. Had a guy come in, hit by a drunk driver in a crosswalk, 39-year-old vet. Survived 3 tours without a scratch. I spent the last 2 hours coding it.
He said he coded his patient. What that means is coding is when someone's heart stops pumping, their lungs stop working, they can't breathe. And so oftentimes you think about like the paddles and the shocking, you think of a patient being rapidly given medications and all sorts of modalities to keep them alive or to revive them. And it's an emergency setting. It's quite traumatic.
Because this is the job that keeps on giving. Nightmares, ulcers, suicidal tendencies. Besides, if you jump on my shift, that's just rude, man.
Every physician has lost a patient, and most of us have lost many patients because that is the cycle of life. It is honestly the hardest thing ever to deal with. And you can tell that this physician is really grappling with this, as pretty much every physician does. His colleague says, you're not going to jump on me. Don't jump on my shift. I mean, he's making a joke, but the truth of the matter is, let's talk about physician suicide. Did you know that 300 to 400 physicians commit suicide every single year? And the rate of physician suicide is higher than the rate of suicide for the average population. More doctors commit suicide than many other people, many other groups of people. It is a problem.
And we all know Louis Cloverfield, blood alcohol of 420 at 11 p.m.
I've been cutting back.
How is he still breathing?
That's a lethal dose for you and me. That's happy hour for Louis.
Sobered up, had 2 rounds of lorazepam.
Hold out your hands for me, Louis. Another 2 lorazepam.
On it. And a script for Librium.
It's good to see you, Louis.
It's always a pleasure, Doc.
This patient is well known to this hospital, so much that the doctors, the residents know exactly who he is. By the way, every hospital, every doctor's office has patients like this, okay? Sounds like this patient is a heavy drinker. I mean, I'm telling you, his blood alcohol level is pretty darn high. And also that sort of shaking. Sometimes people who drink a lot can have the shakes.
Good Samaritan dude has a small left temporal intraparenchymal bleed. No epidural, no subdural, no midline shift in the brain.
That's good news. He could recover.
CT can take her in 5. Let's have a look. Bandage scissors.
All right. If an artery is totally transected, the smooth muscle in the tunica media contracts with hemostasis.
But if it's a partial cut, get out your umbrella.
Grab a culture from the open fibula before you reduce. You're up.
I'll stabilize the knee for the reduction. Dr. Langdon will be distracting distally before moving medially to clear the tibia. Good. Ready?
Med student down.
This actually happened to me when I was a medical student. For me, when I almost passed out, it was during a C-section. I'd never seen a C-section before. I was on my OBGYN rotation. It blew my mind how C-sections worked. I will never forget it. I got dizzy, I got lightheaded, and I started to kind of get wobbly. And I was told by my attending that as a senior physician to go sit in the corner. I had to go sit in the corner because I became overcome. So this is something that's not uncommon.
Can you wake up for me, Tyler? He's not usually this sleepy.
No, and he barely flinched for the blood test.
He wakes up at 90 miles an hour and doesn't stop till he passes out at night.
He passes out?
No, he just means he goes all day.
Any chance he could have ingested something? Any pills, vitamins, any prescriptions that may have been left around?
No, that's all kept locked in the medicine cabinet. The whole house is childproof.
What about alcohol? Anything left out?
No.
What about pets?
No.
You say he's usually like quite active?
Very.
Any injuries lately?
No.
Bumped his head recently?
Not that I'm aware of, but he does live roughhousing with Drew.
But he never gets hurt.
Oxygen level is normal. Good pulse and blood pressure. No signs of infection. We're going to start with blood and urine tests. Check for any metabolic abnormalities.
What are we missing?
Is he waking up?
No, he's still fast asleep.
Most of the lab results are in and they look great. No abnormal blood count, no electrolyte abnormalities, no diabetes, no kidney disease, so.
Good, so what's wrong with him?
We're still trying to figure that out. It looks like some sort of gelatin. Any chance he could have gotten into some bath beads or laundry pods?
No, and there's no such thing in our house.
What about gummies?
No, we're very strict about candy. Right?
Oh, shit. Danny.
What about Danny?
Your brother, he gave me some gummies he got in Cleveland. They were in my coat pocket.
Are you fucking serious?
Pot gummies?
Yes.
We are seeing a rise in poisonings and intoxication in children from THC gummies because parents and other people in the household may have them around. We're seeing accidental exposures and accidental poisonings from these. You've got to keep everything locked away and safe. Guys, let me know what you thought and think of the Pitt. Let me know what you think about the season and what's happened and stuff. Let me know if you like this video. Please share it with other people. I'm Dr. Jen Cottle. I'll do other episodes if you want. Let me know. Subscribe to my channel. I'm on Facebook as well. Please like my page. I'm on Instagram, TikTok, LinkedIn, WhatsApp, all the good stuff. Also go to my website, drjencottle.com, to sign up for my free health newsletter. All right. Love y'all.